A presentation covering a discussion of the recent changes and their impact on the role and responsibilities of the registered nurse. Secondly, a discussion of the role of the Nursing and Midwifery Council in relation to nursing practice. An analysis of the implication of the code on nursing practice and the role of the registered nurse. An explanation of the need for effective communication in a multidisciplinary healthcare setting. And lastly, it will be covering an evaluation of the effectiveness of the multidisciplinary approach in a healthcare setting, which must include the positive limitations and effectiveness of the multidisciplinary approach to nursing practice. Firstly, who is a nurse? A nurse is someone who plan and provide medical and nursing care to patients in hospitals, at home, or in other settings. Who is a registered nurse? A registered nurse is a nurse who has completed all educational and examination requirements and has been licensed to practice nursing in their state. Going to a discussion of the recent changes and their impact on the role and responsibility of the registered nurse. The role and responsibility of registered nurse have changed significantly over time. In the past, nursing was mainly seen as a job for women, with medical skills being passed down from family members and other women in the profession. Nursing was seen as an extension of the duties women had at home with little formal medical training. Today, the nursing field has grown significantly with more diverse staff, multiple levels of association in the sector, and more training opportunities both in the classroom and in the workplace. These changes have helped to improve the effectiveness of medical care and create more pathways for students interested in pursuing a career in nursing. The healthcare sector has undergone a tremendous transformation over the years. In the early days, the only way to receive medical attention was through home visits by a doctor. However, with the advancement of the education system, nurses were better equipped to handle cases with more compassion and positive attitude. Hospitals have also evolved in response to socio-economic and technological changes, increasing the average age of the population. Moreover, given the high prevalence of certain diseases, the health system has implemented primary prevention programs such as free screening for the population, which have saved lives and shaped positive generations of dedicated medical professionals. Furthermore, given the high prevalence of certain diseases such as cardiovascular and cancer, the health system has responded by promoting primary prevention programs such as free screening for the population. The education system has also adapted to this change by modernizing the training offer and encouraging competent and autonomous health professionals. These professionals are specialists in various fields of medicine and collaborate with medical experts to make their tasks safer by ensuring a high degree of specialization in a specific medicine sector. They have more responsibilities and pressures, not just in the health sector environment, but also when students need training every year from different universities. This aspect is essential for the healthcare industry. Nevertheless, doctors remain the cornerstone of patient management. The UK is no longer the only responsible licensed health professional, given the cost of a doctor compared to other health professionals and the country's importance on low cost. The primary purpose was to optimize resources and ensure that other health professionals can now perform more tasks, such as the nurse role. The nursing field has drastically changed over the years, not just in varying roles, but also in science and technological aspects. The skill set and expertise used in the 90s to become professional healthcare are no longer in place. They have more responsibilities and pressures, not just in the healthcare environment, but also when students need training every year from different universities. This aspect is essential. A few years ago, the mentor would be an everyday experience working in the field and learning from the mistakes, knowing what is not suitable and what is a positive impact for the patients. In recent years, the importance of providing high quality care has become increasingly important. This has led to many professions evolving over time in order to meet the needs of society. In the UK, for example, nurses must complete a 3-year academic course but can then further specialize in other roles by taking additional courses. Midwives, on the other hand, take a 4-year pathway that is separate from nursing and are responsible for providing care and support to pregnant women and their families. Opticians can also specialize in areas such as performing ultrasounds. Ultimately, these changes have been necessary in order to ensure that the best possible care is provided to those who need it. Our vision is to create a safe, effective, and kind nursing and midwifery practice that improves everyone's health and well-being. As the professional regulator of almost 732,000 nursing and midwifery professionals, the Nursing and Midwifery Council has an important role to play in making this a reality. The Nursing and Midwifery Council is committed to monitoring and supporting high education and professional standards for nurses and midwives all over the UK, as well as nursing partners in England. They strive to maintain the register of professionals eligible to practice and investigate any circumstances about nurses, midwives, and nursing assistants, with less than 1% of professionals changed each year. The regulation believes in giving experts the chance to address concerns and be in charge of taking action when necessary. To ensure that everyone is supported, the management creates valuable resources and guidance to help people throughout their careers and encourage them to practice the standards. People are also involved in investigation to increase their practice and personal experience so that they feel empowered to shape their work. In March 2015, a new system was introduced to replace the 2008 Nursing and Midwifery Council, further enhancing the support given to experts in this sector. The Code, Standards of Conduct, Performance and Ethics for Nurses and Midwives, is an important set of principles that should be followed by all nurses and midwives to ensure that they are providing safe and quality care. This code outlines the professional measures that nurses and midwives must meet to be registered to practice in the UK. The standard by which nurses, midwives, and nursing associates practice are significant to the services provided, as they ensure that every development and declaration made by a nurse, midwife, or nursing associate is administered by trained professionals with standards and principles. A nurse, in this case, has the responsibility to keep safe all the staffs and providing good quality care provided by the team. The NM Code of Conduct should be used to underpin the practices of all nurses and midwives and remind them of their professional responsibilities. It should be used as a tool to guide daily practice for all nurses and midwives, and it should be used alongside other standards, guidance, and advice from the Nurse and Midwifery Council. Nurses must refer to it regularly to remind themselves of the fundamental principles set out in its different sections, such as the importance of trust and the privilege of caring for individuals. The code should be used to support professional development and should be used to ensure that nurses and midwives are always following essential principles. As healthcare professionals, nurses have a great responsibility to provide the dignity of their to respect the dignity of their patients and maintain their privacy. Teamwork is also essential to provide the best for a patient as it can bring positive emotions and encouragement in any situation. Good communication and collaboration between healthcare members is necessary to ensure the patient receives the best care. Honesty is also a key to show professionalism, compassion, and openness to problem solving. It is sometimes easy to forget the greatness of these responsibilities, but it is essential to remember them in order to provide the best care. Healthcare organizations need to ensure that the patients will receive the proper care, which takes more than just operating methods and performing diagnosis. Communication is essential in all aspects of the healthcare sector. This includes sharing patients' data between departments, consulting with a group of experts, nurses, and other professionals to determine how to treat patients and more. Companies with effective language policies can improve their patients' health, whereas those that lack sufficient procedures can have a negative impact on their well-being. Healthcare professionals, specialists, and establishments need to realize the importance of communication in healthcare to advance. Poor communication has had a significant impact on patient safety and cost, with a study published in Fiance Healthcare showing that 1,744 patient deaths and over $1.7 billion in malpractice costs have been attributed to it in the past 5 years. Therefore, it is essential for healthcare providers to implement effective communication methods both intra-hospital and inter-hospital to protect their patients, save on costs, and increase day-to-day operating efficiency. Moreover, patients benefit from increased access to their medical histories, which reduces the chances of medical errors. Nurses play a key role in coordinating and managing patient care, from providing a reference point for the patients to supervising the entire team. This profession requires a variety of responsibilities, such as taking an assessment of the patient, booking the appropriate medical visit based on the individual's illnesses, arranging X-ray appointments, observing the procedure followed by each patient, and evaluating different medical treatments among different specialists. Ultimately, the nursing remains a fundamental pillar and point of reference, taking on an educational and central role in the multidisciplinary team. The roles can vary from a department manager of a care home to a variety of other positions. As part of the healthcare management team, I understand the importance of multidisciplinary teamwork in the British National Health Service. Working in a team requires many skills, such as understanding the roles of each professional and how they can combine their skill sets to provide the best care for patients. By having regular meetings to review the work and discuss the individual needs of the patients, we can create the best care plan for them. I am confident that with the combined experts of all the professionals in the team, we can provide the highest quality care for our patients. In conclusion, the nursing profession has gone through many stages of evolution and reform. It has come a long way since the Middle Ages when care and assistance was provided in convents, monasteries, and travel routes. Nursing is now a respected profession, with nurses being increasingly prepared and competent, contributing to a solid improvement in clinical practice, care, and assistance. Despite this progress, there is still a need for social, cultural, economic, and employee recognition. The first hospitals were originally created to provide shelter to anyone in need, but in the mid 1400s, a shift occurred in their institutional and organizational setup. Caring for people was no longer just about providing shelter, but also about tending to their physical health. This marked the beginning of distinguishing illnesses based on each individual conditions. Based on the findings of this assignment, it is recommended that more information be made available on different websites and that the code of practice be more widely disseminated. Additionally, it would be beneficial to include a real story or experience from a nurse who works in the field in the essay, as this would make the essay more engaging and attractive to the reader. By doing so, it will help to further illustrate the real commitment of nurses in this sector and provide a more comprehensive understanding of the roles and responsibility of registered nurse in multidisciplinary team. Thank you.